From year to year, agitations of workers in the health sector have caused interruptions in the healthcare delivery, leaving patients and their relatives at the mercy of medical practitioners, particularly those in public institutions.
The duty of a teaching hospital is divided into three. You have research, you have training, you have services. In all of these, at least I'm sure that two are very down. Now, what we'll do as residents majorly, or what I say the government always look onto from us as residents, is the service part. That we should just ensure that things are working, even when we are not fine ourselves. You can imagine that in this hospital, I've had cause to lose residents to stress. I've had cause to lose house officers in this hospital, and you will not believe it. I think about 2 weeks or thereafter, or the following week, I had almost 40 house officers followed. That tells you how much we have managed human personnel in this hospital. I'm just talking about human. There has been a lot of brain drain in recent past. Of course, you know the common denominator. If I'm here and I'm earning 1/4 of what a colleague in teaching hospital is earning, 1/4, when I have to do a lot of work, not even times 3 or times 4, of what they do over there, you know.
Health professionals complain of poor and obsolete medical facilities and equipment, welfare, delayed remuneration and funding.
It's not that we can get everything as far as this place is concerned. When in ICU, we have ventilator, but that cannot. Sometimes we have major problem such a way that sometimes as little as a nebulizer can give issue to a problem. Just small as nebulizer is. So we have issue with that. You imagine that I want to do X-ray for a patient in ICU. I have to see a way of transferring that patient. There's no mobile X-ray. I have critically ill patient that merely moving them can cause them a lot of things. About cost to transfer patient from this hospital to Ondo, to Ibadan, to Ilorin for cranial city. And you know when you do a critical transport of a critically ill patient, only God can say what will happen at the end of the day. So all of these have affected the training and the service you render to patients. And you will believe, you will agree with me, that the common problem is still part of why I said that our welfare had not been catered for. It is still money. Inadequate funding of hospital, inadequate funding of residency training.
What does it need to have a standard primary care? To have a building. The building will be able to take care of normal deliveries, because obstetrics will always come. Women that are pregnant with their conditions will always come. So they'll be able to have things that they will use to take care of pregnant women and take care of their delivery. You have things to take care of everyday illness like malaria, typhoid fever, all those little ailments. That is for the local government. Then when it comes to the state government, which now is supposed to take care of the secondary healthcare level, those will have to have a standard general hospital and probably maybe a central hospital. And this will also have the minimum standard. When it comes to surgery aspect, they should have facilities to treat some of the ailments that doesn't require to go to the teaching hospital. They will be able to have a standard theater. Then they will be able to have a good maternity ward where those from the primary health care, when they are referred, will be able to get there and get good treatment. Then the pediatric section should be well equipped. Then, as we say, manpower is the key. Have adequate supply of doctors, nurses, and other allied health workers. Then when it comes to the federal government, I would say they are trying to do what they can, but it will be better for them to sectionize to prioritize their teaching hospital, make specialist centers, maybe like in Kano can just be for renal transplantation. Everybody that have things to do with renal transplantation will be referred to Kano. Let Ibadan be for cancers and probably radionuclear medicine, all those kind of stuff. Just make it, what they are trying to do today, that every center should have everything. That would be very heavy for the federal government, and they should prioritize things like that. And when you do that, each center will have enough patient load to run the system they have, and things will be better for it.
According to experts, In the 2017 budget of 7.298 trillion naira, Nigeria will spend 1,688 on the health of each citizen in the year, a 4.17% of the total budget. Currently, the health sector has 304 billion naira to cater for over 180 million Nigerians. The wife of Nigeria's president, Aisha Buhari, and her counterparts from the 36 states of the Federation arrived at a stakeholders meeting on reproductive, maternal, nutrition, child advocacy and health at the banquet hall of the State House.
The Future Assured program and wife of the President of the Federal Republic of Nigeria.
The challenges of the nation's health delivery system is the major focus of her talk. She calls for a probe into the 3.2 billion naira budget of the State House Medical Center.
Director
The Minister of Health, Dr. Isaac Adewale, also drops a bombshell on some disturbing statistics.
The maternal mortality ratio is 576 per 100,000 live births. Maternal mortality ratio remains unacceptably high, despite reduction of maternal mortality globally. A strong advocacy by Your Excellencies to your governors to invest in health, as they do to other physical infrastructure like roads, to me, will be most essential and desirable.
Okay.